Hello, my name is KK Smith and I'm a senior athletic training student at Florida Gulf Coast University. And today I will be demonstrating how to conduct a cranial nerve assessment. And with me today is Amanda, who will be pretending to be my student athlete. All right, so the first cranial nerve is the olfactory nerve, which has to do with your sense of smell. So I'm going to have Amanda here smell something, and I want her to tell me what it is. And this is what she'll be smelling.
My eyes are closed.
Can you tell me what that is?
Hand sanitizer.
All right, so she got it right. We'll be moving on. The second cranial nerve is the optic nerve. So to test this one, I will shine a light in her eye and make sure her pupils dilate one at a time. All right. All right, and that one dilates. And that one dilates as well. And also to check this one, I can have her read something. So I'm going to have her read the title to this book. Can you read that?
A Land Remembered.
All right. And then I can also have her tell me when she can see my fingers. So can you close this eye for me, please? Just one eye. And then I'll move my hands from the back and tell me when you can see my fingers.
2.
Okay. And then other eye, close this eye. All right. Tell me when you can see my fingers.
I see him.
All right. That's another way to check the optic nerve. Okay. So the third cranial nerve that I'm going to go over is the ocular motor, and I'm also going to put this with the trochlear and the abducens because they're all for the eye. So the trochlear is upward eye rolling, and then the abducens is lateral eye moving. So to get all of these, I'm just going to move my pen light in an H formation and have her follow them to make sure her musculature is working correctly. So see this black tip? Can you follow this for me just with your eyes only? Right. And she's good. So the fifth cranial nerve is trigeminal, and this nerve is for chewing, and it innervates the forehead, cheek, and chin. And first, I would check to make sure that she has sensation in her face. So, can you feel this? Close your eyes.
So oily, bro. I'm sorry.
Can you feel that? Let's see, forehead, face, cheeks, chin. Oh, can you feel that? Okay, so she's good. And then I would make sure that her musculature in her face is working as well. So can you bite down for me? And can you protract your jaw, like push it out and retract it? And so I think she's doing fine. The seventh cranial nerve is the facial nerve. And check this nerve, I will have the athlete make facial expressions. So can you smile for me? Can you frown for me? Can you stick your lips out and like a kissy face? All right, so also, can you raise your eyebrows? Okay, good. So that one's good. And the eighth cranial nerve is the vestibular cochlear. So to check this one, I will check her hearing. So can you stand up for me, please? All right, and face that way. Okay, so I'm gonna snap, and I want you to tell me what ear you hear it in, okay? All right, and that's one way you can do it. And then also, I would have her, can you stand on one leg for me to check your balance for a couple seconds? And if there's any swaying, then you would know that her balance is off and something is wrong. Okay, you're good. The ninth cranial nerve is the glossopharyngeal, so I would ask her to speak for me, but we already did that when she read the title from our book. But if you want to say something, you can go ahead and say something.
Hello.
And also, to check this one, I would have you swallow. All right, she's good. Okay, and the 10th cranial nerve is the vagus nerve, so I would have her stick her tongue out of her mouth. All right, now put it back in. And can you open your mouth for me? And I'm going to check to make sure that her palate elevates and that her uvula dilates. And she's good. The 10th, what are we on? 11th. The 11th cranial nerve is the spinal accessory nerve. So I would have her lift her shoulders. Sorry. And this is the traps, making sure that her traps work. Also, can you do it against my resistance? Okay, turn your head that way. No, just your head. Turn your head that way. Turn your head that way. That way. Okay, now can you resist me? Go back. And then go back that way. And then resist me coming this way. All right, so that would be the 11th. And the 12th cranial nerve is the hypoglossal, so just stick your tongue out for me. All right, okay, you can go ahead and sit back down. I'm done with you. All right, and that's the cranial nerve assessment. Thank you for watching.
Please
thank you.
subscribe. Please subscribe.